Assalamualaikum everyone. My name is NURUL ROSLI, holding MATRIC card number D2023110684. This video is about breaking the silence to destigmatize mental disorders. So today, I would like to explain a mental disorder about catatonic schizophrenia. Before 2013, catatonic schizophrenia was recognized as a subtype of schizophrenia in the Diagnostic and Statistical Manual of Mental Disorders (DSM). In the most recent manual, the DSM-5, catatonic schizophrenia was combined under the general category of schizophrenia. It now describes someone living with schizophrenia but also meets the criteria for a catatonia diagnosis. But before that, do you guys know what is catatonic schizophrenia? Catatonic schizophrenia is a subtype of schizophrenia that includes catatonia as a key feature. Experts no longer recognize it as a diagnosis, making this name obsolete. Today, experts recognize schizophrenia as a specific disease and a spectrum of disorders. Catatonic schizophrenia is the term for schizophrenia where catatonia is the most dominant feature. Catatonia is a syndrome, a collection of signs and symptoms where your brain doesn't manage muscle movement signals as it should and you behave abnormally. It happens with many other conditions, but schizophrenia is frequently associated with catatonia. Once thought to be the only condition associated with catatonia, it's now known that bipolar disorder is more commonly associated with catatonia, and that catatonia occurs alongside a number of medical and mental health conditions. Historically, experts have recognized up to 40 different symptoms that can happen with catatonia. These are the signs of catatonic schizophrenia. The person acts upset or irritable for no clear reason. It only counts as a symptom of catatonia if it happens and isn't a response to something around the person having it. Next, echopraxia. A person mimics or mirrors someone else's movements or behaviors. Mutism. This is when a person is either very or totally quiet and verbally unresponsive. Catatonic schizophrenia patients also having stereotypy symptom. These are repetitive movements that don't seem to have a purpose. They can include finger play and patting or rubbing one's body. Next, stupor. This is when a person is awake but doesn't respond to what's happening around them. People with catatonia often don't respond to painful stimuli such as being pinched. The other symptoms, posturing. This is when a person holds a specific position which would often be uncomfortable to people who aren't experiencing catatonia. For causes and risk factors, experts haven't yet uncovered a confirmed cause of schizophrenia, but they suspect there are many factors that can play a role or contribute. One of the causes is chemical imbalance in your brain. These are chemicals your brain uses for brain cells to brain cell communication. Next, congenital brain problems. These are problems that happen as your brain develops in the womb before you're born. Last but not least, communication disruptions between areas of your brain. These are networks of connected brain cells, neurons, that communicate across different areas. These networks of neurons link different parts of your brain so they can work together. Researchers suspect that when these connections miss, schizophrenia can be the result. For risk factors, experts believe there are several risk factors that can increase the chance that you'll develop schizophrenia. One of the risk factors is genetics. Individuals with a family history of schizophrenia have a higher risk of developing it themselves. Next, viral infection. Some recent studies suggest that viral infection may predispose the children to develop of schizophrenia. Fetal malnutrition. If the fetus suffers from malnutrition during pregnancy, there is a higher risk of developing schizophrenia. Next, person's stress during early life. Severe stress early in life may contribute to the development of schizophrenia. Stressful experience often occur just before schizophrenia appears. Next, childhood abuse or trauma. Age of parents at birth. Older parents have a higher risk of having children who develop schizophrenia. And the last one is drugs. The use of drugs that affect the mind during adolescence may increase the risk of developing schizophrenia. Prevalence of catatonic schizophrenia. About 85 people out of every 10,000 will develop it during their lifetime. Worldwide, healthcare providers diagnose about 2.77 million people per year with this condition. Catatonia happens in a small, but still noteworthy, percentage of people with schizophrenia. And if you can see, here are the examples of people having catatonic schizophrenia. This video is about 3% showing characteristic symptom of catatonic schizophrenia. These patients have been hospitalized from 5 to 15 years, and the stupor is not as complete as it was during the acute stage of the illness. The leading symptom is immobility and lack of activity. Most of the time, they seem to be oblivious of the environment. It is usually treatable, though not curable. However, when conditions also involve catatonia, different treatments are required. About the intervention, how catatonic schizophrenia can be treated, and is there a cure? There are ways to treat schizophrenia that's currently causing catatonia. The first one is medications. A specific class of medication is usually the first line of treatment for schizophrenia with catatonia. Next, electroconvulsive therapy, ECT. This treatment involves sending a mild electrical current through your skin and skull and into a part of your brain. Next, hospitalization. When symptoms are severe, the person may need to spend time in a hospital. And the last intervention is psychotherapy. These can identify and adjust their feelings and ways of thinking and manage their symptoms. Last but not least, message for public. It's impossible for people to manage schizophrenia and take care of themselves, even if you have a history of catatonia symptoms. You can take your medication as prescribed, and don't stop taking them without first talking to your health provider. Next, you can see your provider as recommended. These visits can help with adjusting medication or treatment plans to help you best. If you think you have the symptoms, please don't ignore or avoid your symptoms. Next, avoid alcohol and recreational drug use. These can worsen your symptoms or cause other problems. You can also consider seeking support and build relationships with people you trust, especially your loved ones, your family, and your healthcare provider, and don't isolate yourself from them. That's all from me. Thank you for watching.